Hi everyone, I'm Dr. Georgina. Today I want to talk to you about a technique we're using here at Bliss Dental to place dental implants. It's called 3D guided surgery, and let me tell you, if you're one of those patients that have been postponing your surgery because you're afraid of the recovery time of the actual surgery, you think it might be an invasive surgery, well, let me tell you, this will be a game changer. So first, we compile some data, right? We get your cone beam of your jaws, and then we get a digital scan of your mouth. The cone beam is going to give us, it's like a 3D x-ray, right? It gives us the images of your bones in every angle. It shows us your anatomical structures of importance, like your sinuses, your lingual nerve. It'll show us all the important details. So based on this information, we are able to put it in a software. I'll show you a slide here on how it looks on our software. So with our software, we're able to choose the length of our implant, the width of our implant, and even plan how your future crown will go. How big is it gonna be? It's just amazing. So after we've compiled all that information and we put it in our software, we're gonna go ahead and create the surgical guide, which is this little guy right here. It's basically just like a plastic stent, acrylic stent with a little metal sleeve in the middle, as you can see right there. In this case, it was just one implant that we placed, but if it's multiple implants, well, it would have multiple sleeves. What this does, it's just how the name says it, right? It's gonna guide us through the surgery. It's gonna guide us with the angulation of the implant, the depth. There's no risk of us going more one way or tilting our implant more on one way than the other, or drilling a little too deep, because everything was already pre-planned. So this is what we use during implant surgery. I'm gonna go ahead and show you a little bit on how the whole workflow of the implant is. So in this case, we did a upper right side premolar, and as you can see on this slide, we are placing the surgical guide. We're making sure that it fits properly. Now this surgery was a flapless surgery, meaning we had to lay a flap or the patient needed any sutures at the end. It's very, very minimally invasive. So first we make a very tiny incision through this little hole, and then we follow our drilling protocol according to our implant measurements. We're ready to place our implant. We place our healing screw, and that's it. We just have to let the body do its work, heal. We are probably gonna wait around 4-5 months for this implant to heal, and then we'll be ready to do the restorative part, which is placing the implant crown. So what are the benefits of this new technique? Well, first off, it's a less invasive surgery. It's more predictable, right? There's less room for error. Of course, there can still be things happening, but I feel that with the newer technology, we just narrow down our room for error, right? And we have more predictable results for our patients. Also, it's just a faster surgery. We can do it faster than a traditional implant placement. And recovery is just amazing. The fact that you don't need any sutures, it's a big deal with patients. Now, don't get me wrong, sometimes we do have to lay a flap, but if we can avoid it, we can definitely go ahead and do your surgery flapless. I've had patients telling me they felt nothing from start to end. They had to just eat, soft diet after after a few days, but they didn't even have to take any pain medications. So that's good news for you if you've been thinking about getting that implant and have been postponing it for any reason. Go ahead and give us a call. We're offering complimentary consultations, and we can tell you if you qualify for this type of surgery. I look forward to meeting you. Thank you.